Today I'd like to discuss the strongest evidence in favor of masking. That's right. Operation Unmask America is going to examine the best arguments put forth by the experts who disagree with us. And why would we do that? Well, because that's how responsible, honest people who genuinely want to know the truth go about forming an opinion, especially when the matter at hand affects entire nations. So with that in mind, let's begin. In an article updated on July 11th, two University of California at San Francisco physicians, both of them medical school professors, one an epidemiologist, the other an infectious disease expert, made the case in favor of masking as a defense against coronavirus. In it, they provided what they call, quote, the strongest evidence in favor of masking, end quote. Now, before we get to that evidence, a bit of context is in order. On July the 14th, CDC Director Dr. Robert Redfield participated in a webinar on COVID-19, and about the use of face coverings, he stated, "We didn't really understand the extent in early February that asymptomatic transmission played. We honestly didn't have the scientific data to support it. We didn't appreciate the asymptomatic disease. As soon as we did, we became big advocates of face coverings." Now remember this as we proceed. Asymptomatic transmission. This is the solitary leg upon which the CDC's support for mandatory masking stands. About the so-called asymptomatic disease, on June the 25th, in a telebriefing with journalists, Dr. Redfield estimated that asymptomatic COVID-positive cases outweigh the symptomatic cases by a margin of roughly 10 to 1. Now, if Dr. Redfield's estimate's correct, that means that for every breathless news report that we hear about a spike in cases, over 90% of them are not sick, which makes it a stretch to say that they have a disease. But let's not get too caught up in the semantics here. What Dr. Redfield and his staff have not considered or refused to consider so far, however, is that asymptomatic transmission, again, the solitary leg upon which his advocacy for masking stands, is a fable. It's fake. It doesn't happen, not because I say so, but because the data says so. On June the 8th, Dr. Maria Van Kerkhove, who is the head of the World Health Organization's Emerging Diseases Unit, stated, "From the data we have, it still seems to be rare that an asymptomatic person actually transmits onward to a secondary individual. It's very rare." The data to which she was referring was gathered in nations that are conducting aggressive contact tracing operations. And the last time I checked, data collection under controlled conditions is still considered an indispensable part of the scientific method, for those who still care about such things. Speaking of which, there is no reliable data, no concrete proof that any asymptomatic person anywhere has ever transmitted COVID-19 to anyone else. So that brings us to a question. Why is Dr. Redfield and the CDC and Dr. Fauci and even President Trump still advocating for face coverings, a position based upon an assumption that we now know to be false? Well, perhaps a better question is, why is he ignoring the data provided in numerous randomized controlled trials as reported by his very own agency, the CDC, as recently as May, indicating that face coverings do not work? In May of 2020, in that edition of the Emerging Infectious Diseases Journal, a CDC publication, it is clearly stated, "In our systematic review, we identified 10 randomized controlled trials that reported estimates of the effectiveness of face masks in reducing laboratory-confirmed influenza virus infections in the community from literature published from 1946 to July 27, 2018. In pooled analysis, we found no significant reduction in influenza transmission with the use of face masks." Let me repeat that. In numerous randomized controlled trials carried out over the last 70-plus years, there's no evidence that face mask use leads to a reduction in transmission. So at this, I think it might be helpful to define RCTs, randomized controlled trials, and the crucial role that they play in scientific research and in matters of public health policy. According to the National Institutes of Health, randomized controlled clinical trials are the gold standard for ascertaining the efficacy and safety of a treatment. The effects of the study treatment are compared with those of a control treatment, and the patients are randomly assigned to the two groups. The patients in the control group receive another treatment or a placebo. Now, in the present case, where the question that we're dealing with concerns the efficacy of masking as a means of preventing viral transmission, under consideration here are two randomly selected groups. They're randomized in as much as the overall demographics of each group, the average age, the health of the individuals, their location, and so on, are similar. This is crucial in order to eliminate any bias or skewed results from the tests. As for the trial itself, one randomly selected group of persons is assigned to wear a face covering. The other does not wear a face covering. And very importantly, they are observed under the same conditions, among which concerns time. Now, this is precisely how scientists came to discover, over numerous trials and many decades, that there exists no significant reduction in transmission with the use of a face mask. Now, if, as Dr. Redfield suggests, scientific data is what is driving CDC policy, one may reasonably ask, where are the randomized controlled trials indicating that face masks really are effective? And therefore, the numerous RCTs that were cited by the CDC as recently as May, every last one of them were wrong. Where are those trials? Where are they? Well, the simple answer is, folks, there are no such randomized controlled trials, not even one. And so this brings us back now to the University of California article that I mentioned. In it, the question is posed rhetorically, why did the CDC change its guidance on wearing masks? Why indeed? I think everyone wants to know the answer to that question. Well, the answers that are given by the UCal professors are very telling indeed. They tell us, quote, the original CDC guidance partly was based on what was thought to be low disease prevalence earlier in the pandemic. Now, one doesn't need to be a scientist to see the flaw in the logic here. The number of persons testing positive at any given time is irrelevant. Either the face masks significantly reduce the transmission of a virus on a case-by-case basis, or they do not. Randomized controlled tests have proven time and again that they do not work, and this hasn't changed. They also tell us, quote, early on, culturally, the U.S. wasn't really prepared to wear masks. Well, clearly, folks, compliance has no relationship at all to the policy position under review here. Either the face masks are effective at slowing the spread of COVID-19, or they are not. The number of people willing to wear them is irrelevant. They also tell us, quote, what may have finally convinced the CDC to change its guidance in favor of masks were rising disease prevalence, something we already discussed, and a clear understanding that both pre-symptomatic and asymptomatic transmission are possible, even common. Now, in spite of this assurance, as we already mentioned, the World Health Organization has already let the cat out of the bag, confirming that asymptomatic spread is, at best, very rare. But just for the sake of argument, let's say that it's not rare. In fact, let's even say that it's commonplace. The fact of the matter is, it's irrelevant. Consider an analogy. A bulletproof vest will either stop a bullet or it won't. It doesn't matter who's firing the gun. Now, in this case, it doesn't matter whether the transmitter of a virus is symptomatic or asymptomatic. And again, numerous RCTs have proven that face coverings simply do not work. Now, at last, here we have arrived at the heart of the matter. The UCal professors ask, again rhetorically, what evidence do we have that wearing a mask is effective in preventing COVID-19? Okay, let's go through the evidence. And as we do, you may notice that one of the most noteworthy things about this evidence is the fact that the authors, who were supposed to accept as men of science, couldn't point to even one, not even one, randomized controlled trial, the gold standard in medical research. Instead, they cited the following, quote, an experiment using high-speed video found that hundreds of droplets ranging from 20 to 500 micrometers were generated when saying a simple phrase, but that nearly all of these droplets were blocked when the mouth was covered by a damp washcloth. Yeah, you heard me correctly. Nearly all of the droplets, in other words, most of them, but not all, were blocked by a damp washcloth. I'm sorry, I can't help but laugh. You can't make this stuff up, folks. If you're a University of California at San Francisco medical student, my advice would be to transfer now and demand a refund on your tuition. This is absolutely unreal. So desperate are certain fake scientists to demonstrate that face coverings are effective at preventing COVID-19 that they're actually pointing to damp washcloths as evidence. It's unbelievable. It doesn't even take an epidemiologist or a high school graduate to know that breathing through a damp washcloth for any period of time is a terrible idea. You might as well just eat a bacteria biscuit and get it over with. Even so, I took the time to read the study paper directly. And what I discovered, if you can believe it, is just as laughable. Here's a quote from that paper. Research from Florida Atlantic University's College of Engineering and Computer Science, just published in the journal Physics of Fluids, demonstrates through visualization of emulated coughs and sneezes a method to assess the effectiveness of face masks in obstructing droplets. So what we have here is some engineering students and computing science students, and perhaps their teachers, set up a mannequin with an air compressor to simulate a person coughing. And when they videotaped the results using a laser, they came up with some very cool imagery. I mean, it's a great exercise in cinematography. It really is. But if you're expecting it to shed light on mandatory masking, you're going to be disappointed. So the first thing to note here is that this experiment was designed to examine coughs and sneezes primarily. Now that's all well and good. But what does this have to do with a public policy that requires face coverings for everyone, including healthy persons? If the policy was limited just to persons who are ill, that is, people who are coughing and sneezing due to a viral infection, we wouldn't be having this conversation. Operation Unmask America wouldn't exist if that was the case. And let's not be naive, folks. The reason why it's not limited to sick people is because it's not about public health. It's about social control. And remember, where the experiment really does address droplets that are, quote, generated when saying a simple phrase, the geeks noted that the effectiveness of the masks is minimal. And so they pointed to the effectiveness of wet washcloths. What they had to say about masks and people wearing masks is as follows. Loosely folded face masks and bandana-style coverings provide minimal stopping capability for the smallest aerosolized respiratory droplets. Importantly, our observations suggest that a higher thread count by itself is not sufficient to guarantee better stopping capability. The bandana covering, which has the highest thread count among all the cloth masks tested, turned out to be the least effective. Let me translate that for you. In other words, their experiment only served to validate, once again, what numerous randomized controlled trials have already proven. Face coverings do not reduce viral transmission. Now keep in mind, folks, this is what the University of California Medical School professors singled out as evidence that wearing a mask is effective in preventing COVID-19. This isn't my evidence. I'm not finding a study to make fun of. This is what they pointed to as being the best evidence that they have. I can only imagine that they just never thought that anyone would actually take the time to read the paper. I can't think of any other reason why they would highlight this particular experiment. In any case, the UCal Med School professors saved the best for last. And finally, they pointed to what they called, quote, the strongest evidence in favor of masks. And they tell us it, quote, comes from studies of real-world scenarios, end quote. Yeah, real world, as if the randomized controlled trials that we've discussed were less than real. I think this is what their psychologist pals might call projection. But be that as it may, the strongest evidence that they can find includes a recent study published in Health Affairs compared the COVID-19 growth rate before and after mask mandates in 15 states in the District of Columbia. It found that mask mandates led to a slowdown in daily COVID-19 growth rate, which became more apparent over time. And they also pointed to another study that looked at coronavirus deaths across 198 countries and found that those with cultural norms or government policies favoring mask wearing had lower death rates. That's it, folks. That is the strongest evidence that these guys could come up with. And if you've been paying attention, you already realize why it's so magnificently weak. Recall what the NIH had to say about randomized controlled trials. The reason why they're considered the gold standard for evaluating the efficacy of a given treatment, it lies in the fact that comparisons are drawn between two groups, one with a certain treatment, the other without, observed under the same circumstances within the same time frame. This is the only way to compare apples to apples. It's the only way to prevent biases from corrupting the conclusions that are being drawn. The so-called strongest evidence that the University of California could come up with demonstrates this perfectly. The professors here, they boldly claim that the study that they cite indicates, quote, mask mandates led to a slowdown in daily COVID-19 growth rate. The problem is, it does no such thing. That a decrease in infection death rates were observed after masks were mandated in some places does not in any way imply, much less prove, that the decrease is attributable, and even in some small degree, to the masking. And why not? Because of the absence of controls that would limit the treatments under observation to just 2. Because that's not there, it means that it's entirely likely that other factors that were present led to the decrease. For example, we know that mask mandates were issued just as people were increasingly staying home, right? Far fewer people were traveling. Far fewer people were flying in airplanes and taking buses and trains to other places. Businesses were being closed, and an increasing number of people began working remotely from home. Even changes in the weather can affect how readily a virus can spread. In other words, no controls as to the circumstances and the number of factors that might also impact the outcome means no reliable data. And this is why randomized controlled trials are so crucial. And it's why the NIH said they are, quote, required by governmental regulatory bodies as the basis for approval decisions, end quote. So, in conclusion, what are we to make of the best arguments put forth by the experts who disagree with us? Or stated another way, how might we describe the method used by the University of California medical school professors to discover the strongest evidence in favor of masks? Well, I would call it an exercise in statistical farming, in search of anything that might give the appearance of supporting a preordained conclusion. Now, there might be a better way to describe it, but one thing is certain, it's not science.